on? Yeah. I feel a little sorry for Joel having to follow Andy, but I'm sure he'll do a good job. Just a comment. Andy mentioned on the 2,4-D that was part of Agent Orange, and there are some people in here too young to remember the Vietnam War, even though I participated in it. But just to tell you something a little more modern, quite a few years ago in South Carolina, we started something called the National Pesticides Telecommunications Network, which was a nationwide toll-free line to call in and ask questions about pesticide events. One of the calls that we got, not infrequently, would be a homeowner, or sometimes a farmer, would be spraying 2,4-D. And while they were doing that, their dog or other animal would be following them and getting the by spray. And what would happen to those dogs is they would collapse. They would be totally paralyzed. Just the by spray. 2,4-D is such a potent neurotoxicant that not only can it cause chronic effects, such as we saw in Vietnam after the use of Agent Orange, but it can cause very severe acute toxicity, and this was seen very frequently in just people spraying their yards. At any rate, it's bad stuff. We really don't want to see 2,4-D resistant crops because it's going to be a terrible disaster for all of us. I'm really here to introduce a very important member of the American Academy of Pediatrics, but as I do that, I'd like to sort of put it in a frame of reference. In the early 90s, I was chair of something the Academy of Pediatrics called the Committee on Environmental Health, which interestingly had grown out of a committee on radiation hazards. When the committee first began, the only thing the Academy of Pediatrics thought we had to worry about was radiation. And then it got expanded right before I became chair. And when I was chair, there wasn't a whole lot of interest in the pediatric community, even though the public at that time told us two things. One is one of their major number one concerns for their children was the environment. They told us at the same time that as they ranked who knew about environmental risks, they said the people who made the chemicals. And they really didn't think doctors knew much about them, and in fact that was true. But then when you asked them a different question, who would you like to get advice from? It wasn't the chemical industry, it was their doctors. So one of the things we've tried to do in the years since then was get pediatricians more involved in environmental health and environmental risk and improving the environment of children. And the person that followed me as chair of the Committee on Environmental Health, Routt Riegart, published a textbook, basically, or a manual for pediatricians on environmental health, which is in its second edition. It is one of the most popular publications in the American Academy of Pediatrics. And then this Committee on Environmental Health, which was a so-called technical committee, got such an interest that it grew into something called a council, which is a different type of organization for the Academy of Pediatrics that anybody can join and now has many members. And over the years, pediatricians have become more and more interested in children and their environments, and the interest in pesticides has grown, which actually brings me to Joel. As a sort of, trying to think the exact right way to say it, but as a landmark in the concern of pediatricians for pesticides, two things have happened in the last year. And I need to go back one more step. I should mention that there are actually 62,000 pediatricians in the American Academy of Pediatrics, so that if we get all of them interested in this problem, it's a really amazing manpower force for good. So in the last year, there have been 2 publications, one that Joel was the lead author on from the Academy on organics, and the second, which came out just last month, the month before, I forget, is a statement on pesticides. Now, what happens with this, and I'm just trying to put it in a frame of reference, is a policy that comes out of the American Academy of Pediatrics is written by people who are expert in the area. It is then goes through a vetting process and finally is approved by our executive committee, which then means that it is policy for 62,000 pediatricians in the country, which is really a major triumph that we've gotten to that point in our evolution, going from all we worry about is radiation to really being much more concerned about children and their total environment, which brings me to Joel Forman. I took 2 or 3 minutes of your time. I'm sorry. Joel Forman is an associate professor of pediatrics and community and preventive medicine at Mount Sinai, New York City. He's always reminding us that the counties that have the highest pesticide use in the country, unfortunately not agricultural, but are in the New York City area, and he might mention that. He is a member of the Council on Environmental Health of the American Academy of Pediatrics. He's a member of the CDC Lead and Pregnancy Work Group. And the most important thing for his talk today is he is the lead author on an AAP report entitled Organic Foods, Health and Environmental Advantages and Disadvantages. This really, as I mentioned a few minutes ago, is a landmark report. I attended a session at the annual meeting of the Academy last fall where Dr. Forman gave a talk based on this, and immediately went up to him after that and said, "You've got to come speak to our annual forum," and he was gracious enough to do that. So, Joel, come on up.
Hi, everybody. Whoops, this one. Hello. Hi, everybody. I'm probably going to go over here and sit and tap on the computer so I can move slides forward, assuming it all works. That was a very gracious introduction. Thank you so much, Routt. And it's really, I have to say, I'm a little nervous following our previous speaker, who's very eloquent. I don't think I'm quite so eloquent. That's fine. Just give me a second to switch to the right presentation. Okay, and I know I need to use the mic. So thank you very much, Routt, and really thank you all very much for inviting me to speak here. It's really a privilege. Just being here already, I've met a few people like Cynthia Curl, who has done some really critical publications and real researchers. I am not, just as a disclaimer, I'm not really a primary researcher. I'm an educator, and actually the biggest part of my job is teaching pediatric residents and running a training program and overseeing fellowships at Mount Sinai. But I also got involved in the late 90s with Phil Landrigan, who's my personal mentor in environmental health, in children's environmental health. I actually met him when I was an intern some years before and have been involved in this ever since the late 90s now, both our training center, which is NIH funded, and our Children's Environmental Health Center, similar to the one Routt has in South Carolina, that's part of a network of environmental health consulting centers for kids around the country. So I'm here to talk about the clinical report in pediatrics, and Routt is absolutely right. The Academy of Pediatrics really sets policy and drives all kinds of things for the country around kids. So it's pretty critical that the AAP has gotten involved in this. I have to say, I'm on the Council on Environmental Health. I'm no longer on the executive committee. It took years to get this clinical report done. It does get very carefully vetted through our own experts and liaisons to the committee, and then all of the other committees and councils within the academy, and then outside review, so it took a long time. And just as a preface, sort of came at this, it's interesting, I co-wrote this with Janet Silverstein, who's a nutritionist from Florida, a physician and nutrition expert, an endocrinologist, and the Committee on Nutrition's view just basically was, well, this is all nonsense about organic food. Organic food is too expensive, and so we're asking poor people to waste their money on organic fruits and vegetables, and they'll actually eat less fruits and vegetables, and it'll be bad for obesity. That's sort of, in a nutshell, that was the view of that committee, and so they wanted to write a clinical report about organic foods so that people would not waste their money on it, because we're interested, nobly so, in the poor and making sure they have access to healthy foods, and clearly obesity is a major epidemic and a huge problem for kids. So they came to us on the Committee on Environmental Health because they knew that we were worried about pesticides and that might be an issue. Our view is the polar opposite, of course, was that conventional fruits and vegetables in the industrialized food system is exposing kids and has many impacts other than just nutrition to toxic chemicals and pesticides particularly. So we wanted to write it the other way, which is in organic food is very important and that the cost differential is artificial and will probably decrease over time. And you already heard about the role of the petroleum industry in supporting quote, conventional or non-organic agriculture, and how that is going to become more difficult as time goes forward and those costs go up. So we worked on this for years together, and I would say there was a lot of movement, and I think from the end result you can see that a lot of people learned a lot of things, and in the end I think our position is, based on the current evidence, is pretty reasonable. So let me go forward here. I will sit because it's easier for me. I have no disclosures other than what you've just heard. So there's just some very basic learning objectives. Being a pediatrician and an educator, we always like to have a few. The first is I'm going to just go over very quickly comparing and contrasting, quote, conventional organic foods in terms of nutrients, pesticide exposure, drug-resistant bacteria, and then the whole host, very briefly, of broader environmental impacts of industrial agriculture, whether it's pollution, global climate change, biodiversity, sustainability, et cetera. And then in particular, hopefully you'll have an idea of and be able to discuss the fundamental conclusions of the Academy's clinical report. The pesticides technical report and policy statement were actually, the lead author was Jimmy Roberts from the Medical University of South Carolina, another close colleague and great friend that I met through the Council on Environmental Health. So we started by, we came to this because pediatricians, so the AP is concerned about what do pediatricians get asked. So we get asked about organic foods. I still do general peds directly on my own. I supervise trainees doing it, and when people ask these questions a lot. So when you look at the literature, why do people do it? This is just a fun little wordle of what are the issues in people's minds when they're talking about organic food, and it ranges from exposure, pesticides, nutrition, is it more healthy because it has antioxidants? All of those issues play in, and there's been a number of studies that look both here and in Europe at what motivates people to consider organic food. So I'm going to first start with the nutrition aspect and dismiss it pretty quickly. And I'll come back to this later. You probably saw there was an article out of Stanford that came out at very close in timing to ours that it was at least interpreted in the press as saying there is no benefit to organic food, which is not actually everything that the article says, but be that as it may, that's what ran in the press. And really the focus was on what's the nutrient advantage of organic fruits and vegetables. It's really what they were talking about. And unfortunately, the evidence that there's a measurable or significant nutrient advantage is not great. It's the weakest argument for organic foods in our review of the literature. The problem is that there are so many confounding things. This is just an example of the kind of research where these were comparing matched pairs of different fruits and vegetables, came from a relatively reputable institution and showed there were slightly higher concentrations of certain nutrients and vitamins in organic fruits and vegetables. But one of the questions we have to ask is, that's nice, there's 10 or 20 or 30% more vitamin C or quercetin or vitamin E, but does that mean anything for your health? That's a little bit of a stretch, and the direct evidence about that is not there. But there's a lot of reasons why that's true, and we made a point of emphasizing this in our clinical report. So the absence of evidence, one way I like to put it is people talk about, in this case would be the absence of evidence of benefit is not evidence of absence of benefit. There just isn't good evidence right now. It's hard to do. Does that make sense? And it's hard to say that. Usually I say the absence of evidence of harm is not evidence of absence of harm. You can say, well, there's no evidence this chemical kills people. Of course, we've never studied it, so there's no evidence that it kills people. So that's the kind of approach that we want to make sure people understand. It turns out, and I didn't know much about this kind of research, but when I started reading about it several years ago, but there's all kinds of things that influence the nutrient content of fruits and vegetables. The soil conditions, the climate conditions, moisture, when you harvest it in the life cycle of the animal, how long it takes from when you harvest it to when you test it for a nutrient, how you test it for the nutrient, how it's stored. All of these things tend to make it difficult to compare nutrient content in fruits and vegetables. I'm not saying that it can't be done, but it's hard. And so it's hard to base the argument to consume organic fruits and vegetables solely on a nutritional benefit for the individual who eats it. Of course, that's a tiny issue in the large decision that we all have to make about organic agriculture. So that's about all I'm going to say about it. I hope we learn more about it, but we don't know that much about it now. And that's what the Stanford article said. They also said, by the way, that they clearly agreed with articles like Cynthia Curls and Dr. Lew's that really you are exposed to more pesticides through conventional fruits and vegetables than organic. But they just dismissed that, saying, well, it's not above government standards most of the time, which is a somewhat meaningless statement. And then they also talked about resistant bacteria that infect us, and they also came to the clear conclusion there was a greater risk of exposure to that through conventional poultry and livestock, pork, etc. That didn't get carried much in the press, and we'll come back to that. So I'm going to move on to the differential exposure. So you've heard already about pesticides, and the other thing I always like to come back to is that really it was really a wonderful talk, and this idea of the distance between us as people who eat food and the people who are farming our food is just enormous. And really all that drives, I think, consumers, to use a dirty word, is the cost, right? I mean, a lot of it is all you see is the price and the labeling, maybe. So you want cheaper. People want cheaper. And a lot of the other costs associated with industrial agriculture don't make it into the cost of what we buy at the supermarket or the store, wherever that is. They're born in other ways. People with illnesses who don't get treated, morbidity and mortality in those people, costs to the government and healthcare dollars, educational dollars, all kinds of things. But that's, those companies are not paying for that. It's being paid for us by society in other ways, so it's disconnected. There's a whole lot of studies that show higher rates of cancers, respiratory illness in farm workers and their kids, and this is just acute exposures. And this data comes from very reliable sources, including the data from, I think it's from EPA, that just looked at the number of illnesses in farm workers. We all know about the Chamkos study that follows prospectively farm workers. It's pretty overwhelming. EPA data about poisonings, 10 to 20,000 acute poisonings that are reported. And it's probably just the tip of the iceberg for the number of poisonings that go on that aren't. None of those costs come into the labeling in the store. And in particular, not only are we worried about acute poisonings, but we're worried about the effect on kids and the offspring of farm workers and how children are exposed. So I'm just going to review very briefly. You heard a little bit about this yesterday. Kids are different. Pediatricians know kids are not just little adults. And in terms of exposure to environmental toxicants, there's a number of ways that we want to make sure everybody understands. So one is, relative to their size, they eat and drink and breathe more and faster than adults. So they're exposed in a disproportionate way. Some classic examples of exposures would be if there's a chemical in the air, say mercury vapor, and a child breathes twice as fast as an adult, they get exposed to 2 times as much at the same concentration. If there's children also have unique developmentally appropriate behaviors. They crawl on the ground, they put their hands in their mouths a lot. So I always like to say lead is a big issue in environmental pediatrics, and it has been for a long time. If you coated this floor, with some massive amount of lead, 5,000 micrograms per square foot, way above the 40 limit of HUD, we could have this meeting in here and meet here for a week, and all of us would probably leave and not get exposed. But if you ran a daycare center in here, you better believe all those kids would get poisoned because they crawl on the ground and put their hands in their mouth. So this is true with soil, and it's true with all these other things. Kids also have a kind of a strange diet. We all know kids eat a lot of apples and applesauce and apple juice. And so if there's a contaminant in apples, they're more likely to get a larger exposure because their diet's so heavy in apples and white things. Kids also have those unique windows of vulnerability, and again, you see the slide of phocomelia. This is just an example from exposure to DES, but another good example is organic mercury exposure in Japan with Minamata, and if you know anything about that, women were exposed by eating contaminated fish, and then the pregnant women had minimal symptoms, but their offspring, some of them had devastating symptoms. And what it illustrates was in fetal life, there are critical windows of brain development, and when exposed to small amounts of, in that case, organic mercury, cause devastating effects, whereas we don't see it in adults in the same way. And then finally, this comes from Phil Landrigan, kids have a long shelf life. So when you get into things like cancer, where there's a latency of probably decades from exposure to disease, if you're exposed very young, you're much more likely to develop that disease before you die of something else, like a heart attack or a stroke or something else. So us older people maybe are at slightly less risk, but certainly young kids and fetuses are at much greater risk of developing diseases related to that. I have to remember to use that clicker. So the CDC's done a great job of measuring exposure. So we have this theory that kids are exposed more because of these unique aspects of children, their unique vulnerabilities in their behaviors. So we know the CDC has been monitoring this and keeps putting this out in the National Report on Human Exposures to Environmental Chemicals. This is data through the 4th report, and it's the non-institutionalized U.S. population. It starts about age 6 up through adulthood. And I just want to illustrate the old-fashioned way. There we go. I want to use this to illustrate that kids are disproportionately exposed. So we have sort of a theoretical framework why they should be. So when you go out and measure, this is chlorpyrifos, and this is a measurement of metabolites of chlorpyrifos in the urine. And if you look at the age groups, the top one is about twice as high for the 6 to 11-year-olds as it is for the adults. And in fact, in many, not all, but many of the chemicals monitored through NHANES and these reports, young kids do have higher levels, which I think validates our theory that they really have unique behaviors and vulnerabilities that make them exposed. So chlorpyrifos, of course, is one of the organophosphate pesticides, very widely used in many settings, both agricultural and for a long time in homes. We're worried particularly about the neurotoxicity in kids, and this is just a brief look at one that people talk about a lot, which is developmental disabilities and autism. And this is from a study that was published by Boyle 2008 and by Boyle in 2011 in Pediatrics, which is the main journal. Pediatrics is the journal of the Academy of Pediatrics. And it looked at the prevalence of developmental disabilities and just are they going up? And the answer is they're going up a lot. Some of it is that we're better at diagnosing them, and so that we're more attuned to it and identifying more, but it cannot all be explained by that. And the rises are pretty astronomical. There's about 10 million kids in the United States with some sort of developmental disability, which is I think 1.8 million increase over the 12 years of the first study, which was the one published in 2008. The prevalence went from about 12.8 to 15%, which is a big increase. Autism itself went from 0.19% to 0.74%. That's about 1 in 135 in that study. If you look at the CDC's data from their Developmental Disabilities Monitoring Network, which is really great. It started out of Atlanta. It now includes many reporting areas around the country. And using a very uniform definition of autism, they came up with a prevalence of 1 in 150 8-year-olds with autism, with an autism spectrum disorder. So very similar data, a dramatic increase. You know, you look at that number, it says a 289.5% increase over the 12 years of the study. I thought it was wrong. I had to go back and triple check that number. That's actually true. It's a relative increase of 289%. And ADHD, which is something that I see in my practice all the time, has also gone up very dramatically, about a 33% increase over the same time. So clearly this is, you know, of the morbidities we see, the problems in kids and general peds, it's obesity, asthma, developmental disabilities are the top 3. Those are the issues that are most common in general peds practice. And as I mentioned before, we know that organophosphates exposure is widespread and higher in kids. So the question is that associated now with disease? So we have a theory that kids are exposed more. We have data, good data, that shows that kids truly are exposed more. So now we want to know, is that higher exposure associated with a higher prevalence of clinical problems, like, say, ADHD? So this great study by Bouchard that was published, I can't even read the 2010, used NHANES data, cross-sectional data, so not quite as good at proving things, but cross-sectional, to look at the association between urinary levels of metabolites of pesticides, so markers in the urine of pesticide exposure, and concurrent diagnosis of attention deficit disorder. They did a pretty good job of defining the disorder. It had to be by diagnostic criteria or the use of stimulant medications that are usually used for that. And they found in the age group that it's very common in, which is 8 to 15-year-olds, that a tenfold increase in DMAP, which is an organophosphate metabolite, was associated with an increased risk. So odds ratio 1.55 means like a 55% higher rate of ADHD in those kids. And kids with just above the mean, with dimethyl thiphosphate greater than the mean, which is one of the most common urinary residues of pesticide exposure, had an odds ratio of 1.93 or a 93% greater chance of having ADHD. Now, this is cross-sectional data, so it's not as great as showing causality. What you would prefer in kids, since you can't randomize them to give some pesticides and some not, is to follow them forward in time in a natural experiment. And that's what are the best sort of alternatives, and those are cohort studies. So we have a number of cohort studies now that also show a direct connection between pesticide exposure and very good measures of brain development, intelligence, behavior. So when you see Bailey, MDI, PDI, that's the motor and psychological developmental index of the Bailey, which is a very well-validated screen, sort of behavioral testing. All the time it was used in the lead research to look at impact on brain development. And a whole number of studies, I'm not going to go through them in the interest of time, but these have been done around the country, some at Mount Sinai, some at Columbia, some in California, like the Eskenazi study, which I'll come back to, all show a variety of effects. Some are easy to measure anthropomorphic data like birth weight and length and head circumference are lower in kids with higher exposure. Other are behavioral issues like with the child behavior checklist from Routt. That's for somewhat older kids, and it's another standardized tool. And then the Bailey from Routt and the Eskenazi study, which is among farm workers in California, which is really critical, that showed even 2 years out from exposure at birth, those that had higher exposure early in life, particularly prenatal, had measurable decreases in their neurologic development. So now this is stronger data, right? This is now going forward in time, exposure, and then clinical problem. And so then it comes back to organics, which is what we were all talking about. And this is one of two really amazing studies. This is by Dr. Liu, and the other one is published by Cynthia Curl, who I think is here in the audience somewhere, who I met for the first time yesterday, that did a very simple experiment. And what's nice about these experiments is they are really landmark. Nobody really debates the results. They're very simple, small number of kids in the 20s, but basically measured, found out through dietary questionnaire or by telling them what to eat, organic or industrial, I'll use the word, fruits and vegetables. And so clearly, conventional diet, organic, and back on conventional. These are just two different measures of different pesticides in the urine. The names are not important, but so clearly, in a matter of days, if you switch your diet, your exposure now goes way down. So we know that there's more pesticides on industrially produced fruits and vegetables, and now we know that if you eat organic, you reduce your exposure. That's very impressive data, and really nobody in the debate out there, no matter which side they are, really argues about this anymore. This is sort of, it's like asked and answered. This question is done. So the remaining question is that level of exposure important? Traditional toxicology always said the dose makes the poison. And so the idea is, well, you need enough to be poisoned, and below some threshold, okay, that's all right. Tiny little exposure, no big deal. So maybe this is too small to worry about. Maybe this doesn't matter. Maybe this level of exposure, we don't care. The benefits from using all those pesticides are so great. A little exposure is no big deal. Well, probably not. And so I just pulled out, so this is Brenda Eskenazi's study of the farm workers. So this is where farm workers' urinary residues of pesticides were measured, and then their offspring when they were pregnant, and their offspring are followed 2 years later where they do the Baileys to look at mental development. And I told you before on the previous slide that there was very measurable and clinically and statistically significant decreases in intelligence and behavior. So what were their urinary levels when they were pregnant? Well, so this is just the MDA level, 0.82 micrograms per liter. Those are sort of meaningless numbers, except when you say, well, what about in Dr. Liu's study? What were the levels in the urine of those kids from just eating industrially produced fruits and vegetables? Funny. It's about the same. I wouldn't say 0.82 and 1.5 are different. The units are the same. Same metabolite, same thing, same level of exposure. So maybe this actual level that we saw in the previous slide, those are important, particularly for vulnerable groups. And in fact, there's a bunch of data out there that suggests this is very true. We need a lot more of it. But so now it's not a meaningless low level of exposure. It's an important level of exposure, particularly for vulnerable groups. So farm workers, pregnant women, women of childbearing age, young kids, for them, because of their unique critical windows of brain development, this level of exposure is probably true. And we're only talking about one problem. So people always ask me when I talk to families or pediatricians, well, can't you just wash it off? Well, the answer to that is there's not much data about it. There's a whole bunch of studies that are done by companies that sell special stuff to wash your fruits and vegetables. Not surprisingly, they all come to the conclusion that their product works. But if you actually look at, this is only one study that I found that was of decent quality, that really took fruits and vegetables, rinsed them the way you might, in a big thing with a standardized amount, just water, rinsing them off. And what they found was there was some reduction in some chemicals. There was really no effect on chlorpyrifos, vinclozin, and some others, and some effect on others. It was very unpredictable. And really, the conclusion is washing is not a reliable way of removing stuff. You can't get pesticides out reliably by washing them. So that sort of answers that question. And we know that when you make the choice, again, we're just talking about your own personal exposure. We're not talking about the exposure of the farm workers to those pesticides, right? We're just talking about as a consumer, can you reduce your exposure? And the answer is washing probably doesn't do it. Okay, so on to bacteria. This was another area the Stanford study actually was very strong on. I was surprised it got no play in the press as far as I could tell. All they talked about was lack of nutritional benefit. So most of the antibiotics used in this country are used on animals, not on people. Depending on who you read and which studies, up to 80% are used on animals. I was like, why are they using antibiotics on animals? Again, I didn't know a lot about this when I got started 5 years ago really reading about it. Well, it makes them grow bigger, so you get more meat per animal or more chicken per poultry, and you make more money. So it comes back to it's really all about money. Most of it's not used to treat disease. It's used in a, quote, non-therapeutic way to promote growth or prevent disease. Why do you need to prevent disease so much in animals? Because they're all packed together so tight in these horrible living conditions. It's long been shown to lead to the development of resistant organisms. You just heard about how the weeds adapted to exposure to pesticides. Well, bacteria are really smart about that. We worry a ton about resistant bacteria, that we're going to end up with one so resistant to all of our weapons for treating bacteria that we get into cases where you have untreatable bacterial infections. This happens in major academic hospitals now once in a while, and we're very concerned about it because the bacteria and the pharmaceutical industry are in this constant race, one ahead, the other ahead. And the same is true here. So if you expose, natural selection, a whole bunch of bacteria to low dose of antibiotics, they get resistant. If you expose them to multiple ones. So there's really, and there's been lots of outbreaks of clusters of the disease in people that can be traced directly back to a contamination from food. So if you look at it, this is sort of a little illustration of non-therapeutic use in animals, therapeutic in animals, and then here is humans, and then, of course, the unnecessary antibacterial soaps. And you can see most of it is really, in millions of pounds used, is being used just to make more money by getting more meat out of your animals. This is just a list of some of the antibiotics used. Some of these might be familiar to you. You ever heard of erythromycin, tetracycline, penicillin, right? Funny, they're really the same stuff we use in people. So it's a very concerning reason. So foodborne illness in the United States, a massive problem, and very underreported too. Just the tip of the iceberg gets reported. There's almost 48 million cases annually reported. This is CDC data. 128,000 require hospitalization. Do you remember, was it last summer or the summer before, where there was the hemolytic uremic syndrome outbreak in Europe? I think it started in Germany. Lots of people died and got very ill. It was eventually traced back, I think, to alfalfa sprouts, contaminated, and it was some of it was drug resistant. There's been cases like that over and over again. Foodborne illness is really a major important public health problem in the United States. So I want to just show you, in terms of resistant bacteria, this slide. So this comes directly from the Annals article from Stanford that came out very close to when ours did. And again, this was part of their conclusions. It got almost no play in the press. But what you see here is, okay, bigger so I can see. This is organic. Can you see my pointer up there when I move my finger? Yes, okay, good. So these are the organic ones, and these are the conventional. And then this is the percent with drug-resistant organisms. And this is the difference. And you can see that every single study, the point estimate of the chance of having resistant bacteria was lower. Every single one, except for one here for antibiotic resistance. And in fact, the ones with the big bars, those are the small number of studies. So there's very clear evidence when you review all these different studies that conventional or industrial poultry and pork, in this case, this was, I think, mostly poultry, has a much greater risk of having bacteria that are multi-drug resistant on them. Now, people will argue, oh, well, if you cook it thoroughly, it doesn't matter because you kill them all. But we all know then there would be no foodborne illness, right, because we all cook our food thoroughly. So there's contamination, and the reality is people do get illness from food, and you take a greater risk when you buy non-organic poultry and pork, without a doubt. And the Stanford article said the exact same thing. Okay, very quickly to touch on hormones. So there's less known about estrogens. Again, why do they use estrogens in cows? To make them bigger and sell more meat, or to get more yield out of it. I understand that they're generally put like in the ear or behind the ear, and they remove it when they then process and slaughter the animals. Most studies show that estrogen levels in cows are similar to cows that don't get estrogen, but there's not a lot of data on it. There's not a lot of data about how that might directly affect human health. Doesn't mean it doesn't. It just means it's hard to study. There's one study that caught our eye that we thought was a little concerning. It's a retrospective cohort study, so it has a lot of limitations. It basically asked people who had breast cancer how much red meat they ate when they were teenagers. You're asking a lot when you ask people to remember that. But there was a very significant relationship between the higher red meat consumers and a greater risk of breast cancer. That is not enough data to, I would say, draw a conclusion, but it was concerning. And we don't have much else that's really good. Okay, bovine growth hormone, because this comes up with milk, so I just want to mention it briefly. My biggest issues with bovine growth hormone is what it does to the cows, not so much what it does to the people who drink the milk. So, people say, again, if you look at it just from the risk to you drinking the milk or your children drinking the milk, there's probably no increased risk. There's no benefit or advantage or disadvantage to buying organic milk, except that it's twice as expensive in most places. And that's because, just so we know, the bovine growth hormone issue, it's different in its structure than human growth hormone. And if you inject yourself with bovine growth hormone, it doesn't do anything because it doesn't work in humans. So that's one reason. There's not that much in the milk. And then when you actually consume it, the acid in your stomach destroys the rest. So really, there's no direct exposure of people who consume conventional milk to bovine growth hormone. The problem is that bovine growth hormone, at least we don't think this much, the bovine growth hormone makes cows produce more milk. It also gives them all kinds of other problems with fertility, more mastitis or uderitis, I guess they call it. Udder infections. What's it called? Laminitis. Okay, there we go. We need a veterinarian in the room. Laminitis, which, of course, leads them to use more antibiotics in those animals. So in terms of humane treatment of animals, infection animals, and using more antibiotics, there's lots of problems with bovine growth hormone. Okay. Sustainability. You're going to hear more from, again, people who are really great about this later. But just to mention, the issues around choosing organic are much broader than just the impact on the individual health of the person who's eating the food. I think that's where the argument gets lost in the press. The broader environmental impact is enormous. The IPCC, I'm sure you're all familiar with them, estimates that 20% of human greenhouse gases are produced through agriculture. 1/5. That's a lot. So if you're trying to do something about global climate change, you have to think about agriculture too, because it's a big part of the puzzle. And then there's all the pollution. So pesticide and herbicide runoff is widespread. I think we're going to hear more about bees and colony collapse, the reduction in biodiversity, and the use of hybrid and GMO. And then just one example of pollution of the water. So atrazine is the most commonly found contaminant in streams and groundwater in this country. It's also, not surprisingly, the most common weed killer used in the corn industry. We just heard that the corn monoculture crop is one of the biggest in the United States. I'm just going to show you one study that I've always found to be really compelling, and this is the Winchester study from 2009. And this just looked at the association between birth defects and atrazine levels in the water, which, not surprisingly, tracks the harvest season. And you can see that they parallel each other, suggesting that there is a relationship between exposure during pregnancy or conception, we're not sure the exact timing, and birth defects. I just had to grab this because it was just in the press. Mystery malady kills more bees. And then followed by, this is all in the New York Times, 2 new studies pointing to neonicotinoids, which you just heard about and we'll hear more about, associated with colony collapse. I think there's just such a clear danger from using these pesticides in terms of biodiversity. And, again, most people don't realize how important pollination is in terms of the production of the foods that we eat. If we wipe out our bees, we're going to have a very big problem. And this is, this year turns out to be a very bad year. And people don't make the connection. I think it's really critical. So I know that later today we're going to hear from the current director, I think, of the Rodale Institute. Again, literature that I got into reading that I would never have thought I would read when I was in medical school. But very impressive. And so now it's 30-year data, right? Not 20, but 30 years of data, I think, that show that, gee, if you know what you're doing, you can farm organically and be just as productive and, in fact, reap many other benefits in terms of soil and conservation of water and less pollution and all of these things. And I think I'm not going to spend a lot of time because people more expert are going to talk about it. But worrying about this is important to consumers too. Just be about what you eat and what happens to you as an individual from consuming it. We should be thinking about all the people involved in the production system, all of their exposures, the impact on biodiversity and the rest of the larger environment we live in. So finally, just to come back to costs, there's all of these hidden costs in industrial agriculture that do not translate into the price we pay at the store. And just a few of them include, so those farm workers who get sick, who's paying for their health care? Not the company selling the food or Monsanto, right? So we're paying for it in our tax dollars somehow. It's just not connected. What about the neurodevelopmental effects, the ADHD, the autism? Who's paying those educational effects? Who's paying for the schools? Again, not the companies that are profiting, so there's a disconnect. But those are real costs. What about cleanup? We had a case that was referred to us where they were building a school in New Jersey. It was a former agricultural site. It turned out it was heavily contaminated with pesticides in the soil, with persistent stuff, organochlorines from way back. Guess what? Someone had to fork out a lot of money to call out lots of that bad soil and put in new soil and put ground cover in. A lot of costs that were not paid for by the people who ate or whatever they did with the crops that were grown on that soil. So lots of hidden costs. And then finally, this whole idea of disease resistance, biodiversity, the things that are going to have long-term impact on our ability to live in this world are not included in the costs that we pay. So what about this price premium? This is what the Nutrition Committee was so concerned about, and the higher expense for people. And I have to say, I was convinced this is an important issue. Most of my own direct patients live in East Harlem in New York City. It's a very poor neighborhood, largely Latino and African American. And so they're kids of color, and they're very poor. They have a high burden of disease, whether it be asthma, obesity, ADHD, autism, really high. And they don't have a lot of money. So if I go to them and say, you have to spend all your money on organic food, and I know, I go to the stores, how expensive it is, this is a problem. And this is just some data from USDA that shows how big the price premium can be. And it's up to 90, 100%. I think we all would agree if you go into stores, some things are really, really expensive. Organic milk is one of them that's really impressive. Here is the milk premium prices. So it's true, there's a big difference. But why is there such a big difference? Well, a lot of it is artificial. It's sort of like we're subsidizing industrial agriculture by not including the true costs of that production method. So really, conventional or industrial should cost 3 times as much as it does now. It's just that we're paying for it in other ways. The other is it's dependent on petroleum products, and those products will get more and more expensive as the supply decreases over time. And the other is, I agree, we're sort of at a turning point. I remember in the early days, 10, 20 years ago, it was hard to find organic, right? You had to go to a special store or have access to a special farmer's market. Now you can go into major supermarkets, and there are organic sections, whether it's Whole Foods or Trader Joe's or Stop and Shop or wherever. And they're growing and growing. And as demand increases, there is, as Routt was saying, there's kind of a tipping point, I think, where consumer demand will push the industry over the top. And we feel much closer to it now than we were some 10 or 20 years ago. So I think this all will change, and it's really exciting to contribute in any way to this process and to be asked to come here. So what do we tell the pediatricians? So what were our conclusions? So we started by saying and dismissing that the evidence that currently exists is pretty poor, that there's a clinically relevant nutrient or nutritional difference between organic and, I should be using the word industrial produce. But the studies are very limited. It's a very difficult thing to study, and it's only a tiny piece of the question about organic farming. Second point is it's extremely clear that there are less pesticides in organic fruits and vegetables. Nobody really debates it. All that people debate is whether that's a meaningful difference. It's also really clear that if you eat organic, you are exposed to less pesticides. Again, not something that people debate, even the other side of the argument. The only remaining question is it a meaningful difference? And the answer to that seems to be yes. The levels of exposure, particularly to women who might have kids and to young kids and to fetus, are clearly in a range that has been documented to have adverse effects. I'm not even talking cancer. I'm focusing on neurocognition because brain development, those issues are so much more common, thankfully, than cancer. So these are definitely relevant even for your own decisions about your consumption, for your own personal health and the health of your kids. It's also very clear that organic husbandry, because it prohibits the non-therapeutic use of antibiotics, helps protect you from exposure to drug-resistant bacteria that can cause human disease. So choosing organic poultry and pork can be a smart thing for your own health as someone who eats it. There's not really evidence that there's a personal health benefit to drinking organic milk. However, the adverse impacts on the dairy industry and on the cows and environmentally of using BGH are real. It's just that it doesn't actually get into you as a person, but that's, again, only a small piece of the question. And then AAP insisted that we include sort of a statement against unpasteurized raw milk. I have to say I know this is very popular in some sectors, but I've also seen disease caused by infections from unpasteurized milk. And really, it's a potential significant problem. There's so many cases of illness caused by diseases, bacteria like Listeria, for instance, or E. coli from unpasteurized milk. So pasteurization, you go back to Abraham Jacobi and the whole movement to boil it till it bubbles. The number of kids, 4 out of 5 kids used to die before they were, I think, 1 in New York City. And it was mostly from diseases from unpasteurized, tainted milk. So unpasteurized milk, I think, is still a problem. And then we get into the larger things in terms of cost. So although it seems that the organic food is more expensive now, it doesn't have to be. It can be cost effective, and clearly, like the Rodale Institute has proven, that this is true. The price premium is somewhat artificial because it doesn't reflect those costs, and it may be reduced. And it may be reduced as demand increases, and it may be reduced as the cost of the oil that is used to make all the fertilizers and pesticides goes up and up as time goes on and the supply of oil goes down. And then finally, it makes sense for us to worry about the broad environmental impact. Clearly, organic farming has a reduced carbon footprint, right? It's very clear from a number of studies. There's less fossil fuel consumption, and there's increased carbon sequestration from the production. And there's clearly less pollution, water and soil, et cetera, which gets to people. And we know that those exposures are related to adverse health effects. So there's the environmental pollution, sort of the classic view of pollution, is very clearly less with organic techniques. So what advice do we want? And this is, I think, the last 2 slides I have for families. So we encourage pediatricians to say, yes, it's important. Fruits and vegetables and a healthy diet is important. Obesity is a big deal. But we want pediatricians to be explicit about what we do know and what we don't, and to focus on the fact that although nutritional value is something people think about, it's not the major driver for the decision organic and industrially produced foods, and that we should focus and make sure people understand the reduced pesticide exposure, the lowered risk of exposure to drug-resistant bacteria, We will mention the pasteurization, and that we should talk about the increased cost and try to mitigate that. And I'll make one comment about that in a minute. Families should not choose organic at the expense of an overall healthy diet, but we should find ways to help them. So being selective in environmental working groups, Clean 15, Dirty Dozen, is just one example of a reference that helps people make choices when they have limited funds, are things we can advertise. And there's little apps for your phone, and there's cards we give out, things that can help people make those choices. And then finally, to really acknowledge that motivation to choose organic based on things other than your personal health or nutrition is very reasonable and important. And we should be telling our families that this is they're not crazy to be worried about the environment when they're deciding whether they want to support. And also, of course, consumer dollars will drive the market. The more people who choose organic, the more will be produced and the lower the costs will be. And this is just a list of references. And that's it. Sorry.
Just one comment. Since I have struggled with producing these kinds of policy statements, you don't know how hard it is to get the whole academy to agree. And I think Dr. Forman is to be congratulated for getting this done. And I think the other thing that you must know is that these things get constantly reviewed and updated for relevance, so that, pediatricians are a little bit conservative, so we may be behind some of you, but as the evidence gets better, this kind of policy will be revised and updated in a way that will look better and better with each year. But I wish I don't know how to tell you what a great thing it was that Dr. Forman was able to get this approved and make it policy for the Academy of Pediatrics. Congratulations. I know people might have questions, but remember we have a workshop on this just a little bit later.